Hi everyone, welcome to today's book summary. Today we'll be diving deep into Rosen's Emergency Medicine, Concepts in Clinical Practice, 10th edition. This book is often regarded as the Bible of emergency medicine, covering the full spectrum of emergency conditions, evidence-based practices, and the latest in clinical advancements. Whether you're a medical student, resident, or practicing physician, this book is an essential guide to the unpredictable, high-stakes environment of emergency medicine. Rosen's Emergency Medicine is a comprehensive reference book that's been relied upon by healthcare professionals for decades. The 10th edition, which we are discussing today, includes significant updates, keeping pace with the rapidly changing field of emergency medicine. This edition consists of over 270 chapters, divided into multiple sections that cover everything from initial patient assessment to critical care. It has practical, evidence-based solutions for diagnosing and treating all types of medical emergencies. The book's standout feature is its focus on critical thinking and problem-solving under pressure, which is crucial in emergency settings. Throughout the book, you'll also find over 1,200 high-quality images, including X-rays, CT scans, and photographs, as well as more than 350 decision-making algorithms. These visuals aid in the quick diagnosis and management of critical conditions, making it an invaluable resource in fast-paced environments like the ER.
Now, let's talk about some of the key updates in this 10th edition. Emergency medicine is an ever-evolving field, and Rosen's keeps up with the latest advancements in research, technology, and clinical practice. Some of the significant updates in this edition include critical care. There's expanded coverage on critical care, especially for conditions like sepsis, septic shock, and ARDS, acute respiratory distress syndrome. The book discusses the latest protocols for managing these life-threatening conditions. Toxicology. There's an in-depth section on toxicology, addressing a wide range of poisons, overdoses, and hazardous substances. New advancements in treatment protocols for drug overdoses and poisoning are covered comprehensively. Pediatrics. Another area that has seen substantial updates is pediatric emergency care. The book includes the latest guidelines for pediatric resuscitation and trauma, which are crucial for those who deal with young patients. Emergency preparedness. Given the current global climate, there is an updated section on emergency preparedness and disaster medicine, providing guidelines for handling mass casualty incidents and pandemics. Trauma management. Trauma is one of the most important aspects of emergency medicine. This edition includes new research on managing blunt and penetrating trauma, including updated protocols for trauma surgery and intensive care. The beauty of Rosen's emergency medicine lies not only in its theoretical knowledge, but also in its practical application. For instance, the book's approach to airway management is incredibly practical and clear, breaking down different techniques and tools like intubation and cricothyrotomy step by step. This is vital because airway management is often the first, and sometimes most critical, step in saving a life in the ER. It also provides detailed instructions on managing cardiovascular emergencies, such as myocardial infarction, cardiac arrest, and stroke. The chapters are laid out in a way that helps you make quick decisions, which is key in emergency settings where minutes, or even seconds, can mean the difference between life and death. Another key aspect is trauma care. The trauma chapters are filled with practical insights on handling complex multisystem injuries, head injuries, and spinal trauma. The book emphasizes the importance of a systematic approach, ensuring that no critical injuries are missed during the chaotic environment of a trauma situation. For toxicology cases, Rosen's offers algorithms for diagnosing and managing overdoses and poisonings, which are often some of the more challenging and high-risk cases in emergency medicine. One of the standout features of the book is its emphasis on visual aids and algorithms. With over 350 decision-making algorithms, Rosen's helps you navigate complex clinical decisions quickly. Whether it's figuring out the next step in managing sepsis, or determining the most appropriate imaging for a trauma patient, these algorithms serve as quick references that can help guide you through even the toughest cases. In addition to the algorithms, the high-quality images throughout the book are extremely helpful. They cover a wide range of conditions, from dermatological emergencies to radiological findings. The clarity and relevance of these images make them great for reinforcing learning and quickly identifying conditions in real-world practice. As mentioned earlier, the 10th edition includes new chapters that address emerging challenges in emergency medicine. One of the exciting new additions is the chapter on emergency preparedness. This section is particularly timely, given the rise in public health emergencies and disasters. It covers how to prepare for mass casualty events, pandemics, and bioterrorism, offering valuable strategies for hospitals and emergency personnel to implement. Another important new section is on critical care in the emergency department. With more patients requiring intensive interventions right at the door, these chapters offer updated protocols on ventilator management, sedation, and post-resuscitation care. So why is Rosen's emergency medicine essential for anyone in the field? Simply put, it's an all-in-one guide that's trusted by practitioners around the world. From new residents in emergency medicine to seasoned professionals, it offers something for everyone. The evidence-based approaches allow you to stay up to date with the latest in medical practice, and the practical tips and clinical pearls make it easier to apply knowledge in high-pressure situations. This book doesn't just help you diagnose and treat conditions, it helps you think critically, act swiftly, and provide the best care possible. In emergency medicine, where the unexpected happens daily, Rosen's is like having a mentor by your side. That wraps up our deep dive into Rosen's Emergency Medicine, Concepts and Clinical Practice, 10th edition. If you're serious about excelling in emergency medicine, this book is a must-have. It's packed with invaluable information, practical guidance, and the latest medical knowledge. If you're looking to get your hands on this essential resource, you can find it and many other top medical ebooks at bookread.xyz. Make sure to check out our site for exclusive deals and more incredible resources for medical professionals. And don't forget to like, subscribe, and share this video if you found it helpful. Thanks for tuning in, and I'll see you next time with another must-read book for your medical career.